So I have to ask, and I know you've noticed this, and I've noticed this at the hospital, but when I was
Mhm.
first diagnosed, it felt like everyone around me was older.
Yes.
And I even had them, they would come up to me because you immediately can identify a patient at City of Hope. There's the people with the visitor sticker, and there's those of us with the wristband. And anytime the older people saw me with the wristband, it was like, what are you in here for? Like, what's going on? You're too young to have cancer. And it seems like now I'm coming up on 4 years, and the more I go into the hospital, the younger and younger the patients are looking. And a
Mhm.
lot of them are female. What do you think about that?
I think it's tragic. I think that there's no exact answer why that's occurring, but I think we were both late stage diagnosed. I think there needs to be more screening and more attention to our symptoms. I think we both had symptoms that, had we received more attention to those symptoms, there's a possibility that we could have been diagnosed earlier. And I feel like we get passed off a lot, right? Because, like you mentioned, we're moms. Moms are tired, right? And we have aches and pains. But when it's so persistent, and when we think something's wrong, when we feel like something's wrong, it would be very helpful if physicians paid attention to those cues.
Yeah, it definitely feels like because we're younger, we're not taken seriously and we don't look sick, right? You come
Correct.
in, I think they have this idea of what sick is supposed to look like. And so they almost kind of chalk it up to, I think you're probably over exaggerating this, maybe even some mental health. And we're just not taken serious. And I really hope that that starts to change because we are trying to catch these cancers early. Problem is, we spend months trying to get people to pay attention to us. And that entire time, the cancer is just continuing to grow and metastasize.